Hey, Dr. Jeff LaCour with Compasio Medical Education. So what should you be thinking if a patient comes in and they're talking like this and they say they've been hoarse for about 2 to 3 weeks? What should you be thinking? Well, let's look at a few causes of hoarseness. Here's a patient of mine that came in with hoarseness, and here's the right vocal cord moving well, but notice that left vocal cord is not moving well at all. Okay, maybe a little bit of movement, but I would say that's just about paralyzed on that left side. So for this patient, I would be getting a CT scan of their neck and chest to make sure there's not a tumor along the vagus nerve. Now let's look at my next patient, who's a lot more common. Now this patient comes in and they're hoarse, but their vocal cords are moving fine. And notice the gap between the vocal cords. That's called a glottic gap, and that's something that speech therapy will usually help. So that's a very common cause, but what are other things that can be causing this? You could have cancer, okay? You can have a hemorrhage in the vocal cord. Rule of thumb, I would say after 3 to 4 weeks, if a patient is still hoarse after conservative measures, then I would send to the ENT provider. By all means, if a patient comes in and they're having difficulty breathing on top of hoarseness, that's a no-brainer. They need to go to the ER or an ENT provider ASAP. Thank you. At Compasio Medical Education, we're bridging the gap between primary and specialty care. Join us in raising the quality of patient care.